Welcome to Washington. I know many of you were here last year for a similar event, and really glad to have you down here at now a pretty interesting time to be in Washington, talking about healthcare policy, and at the same time thinking about its impact on Connecticut. A lot of movement this week, both here and in Connecticut, with respect to what the healthcare system is going to look like moving forward. I just really wanted to be here to thank you for helping to make that bridge, because it's really, really important.
Connecticut Children's has a responsibility for the whole state to take care of children. We can't do that in a vacuum. We have to partner with the state, we have to partner with other businesses in order for us to fulfill our mission. And so it's important that the economy thrive, to create an environment for us to thrive.
It's a unique space within healthcare to practice in what I quite frequently call other people's homes. When you go from state to state, you're really addressing and dealing with a different perspective and different cultures and a different way of delivering service and care and what's important to people.
You know, we recognize that healthcare is an incredible part of the economy in the state of Connecticut. We know we can do better, we have to do better. It's an important priority. At Yale New Haven, we have about 25,000 employees. We're one of the state's largest employers. We take that responsibility very seriously, and so we engage in these types of forums so we can share our expertise and learn from others as well, and it's really important.
It's an objective measure how much of the IP from your academic institutions gets commercialized into local businesses. In other words, they support the spin out of their technology into companies that respond. It's an objective measure how many executives that have been successful have provided seed capital to startups in the community of Hartford.
I think there's a lot that we can do. I don't think we should wait just for federal reform or for state reform, but there's a lot we can do at the local provider level, and I think the takeaway from this last day or day and a half will be, what can we do together immediately to make a difference in the greater Hartford area?
When I was a young professional at Ernst & Young, the partner that was in charge of our healthcare practice, who's now the CFO of one of the hospital companies in Nashville, Mike Collada, basically mandated our involvement in leadership healthcare in the Nashville Healthcare Council. And it's that, and Bobby spoke to this, I mean, it's that top-down sort of emphasis around, you know, if you're going to be part of this organization and part of this community, you're going to be expected to be involved and to give back.
You know, I really felt like it was an opportunity to engage both peers as well as business partners and other types of partners in a dialogue about how do we grow our state, but how do we also try to tackle some of the issues that we have in the health industry.
So taking kind of the themes that we've identified here and being able to get the right folks at the right table back in Connecticut, I think is going to be where the rubber meets the road. And if we can get something done and we can incrementally proceed in making improvements, then I think it's been a success.